So today's presentation, external evaluation and assessment for consumer eligibility determination. Well, that's a mouthful. We wanted to make sure that we address these objectives in today's webinar. The first objective is that we want to identify when it is necessary to complete an external evaluation as necessary for eligibility determination. Objective 2, we also want to describe how to use evaluation or assessment to determine the applicant's disability as an impediment to employment. And objective number 3, we also would like for you to identify resources to access service providers and also to discuss what types of external evaluation are available to consumers.
Hey, Jamie,
And I'm going to hand it off to Paula.
I see Rachel's. Oh, okay, never mind. Rachel has her hand up, but it was just responding to your question from earlier. So sorry about that. Keep going, Jamie.
Oh, no problem. I was going to hand this slide off over to Paula so that she could discuss more about presumption of eligibility. We're kind of going to discuss a little bit of eligibility determination today because in the context of this presentation, we're wanting to talk about how to evaluate or assess eligibility determination. And I'm not sure if Paula's on with us yet.
Yes, I am. Good morning, everyone.
Oh, hey, Paula. Sorry. You know how it is when you're looking at the PowerPoint, you can't actually see Zoom.
No
Good morning.
Good morning, everyone. My name is Paula Sinez. I'm from the Navajo Nation. I work for the program there with vocational rehabilitation. And so I'm glad we're having this conversation about assessments and evaluations because I know it's sometimes very challenging for programs to have the resources for evaluations and assessment. So as Jamie mentioned, we wanted to cover some areas around eligibility to connect this assessment and evaluations to eligibility. And so this first slide just reminds us all that there's a presumption of eligibility. So for Social Security benefits under the Social Security Act, we presume that individuals are eligible for VR services and will be considered at least an individual with significant disability. So again, applicants shall be presumed to be able to benefit in terms of employment outcome for VR services unless they are found to be ineligible for services due to the severity of the disability by clear and convincing evidence, including the applicants who have been determined to have a disability under the Social Security Disability Act and SSI. So again, we use existing information that's available, and we'll be reminding again programs that to utilize existing information that's available. And one of those areas is to use existing information around Social Security. Next slide, Jamie. And the after the third criteria of having a disability or impediment to a disability, the fourth criteria of our eligibility is looking at substantial impediment to employment, which we need to provide documentation that the disability impedes the individual's ability to work. So again, we want to highlight that this means a physical or mental impairment, that it hinders the individual from preparing for, entering into, or engaging in employment consistent with their individual abilities and capabilities. So we'll be looking at what documentation, evaluation, and or assessments would you need to document that individuals meet this criteria, eligibility criteria, which is the fourth criteria for substantial impediment to employment. We'll be looking at key areas around medical evaluations that may be out there, medical records, psychological or vocational, educational records, any other areas that may impede the individual's ability to work. I don't know if you want to add anything else, Wayne, to that regarding that.
No, I think, you know, this, you captured it really well. It's always a tricky slope on this part, because we aren't talking about eligibility only, and it's the documents and the documentation needed to get to that eligibility. So it gets difficult to understand sometimes when we start talking about the different language and how we move forward with it. So I think you guys did good.
Yeah. I just wanted to add some of Paula's notes on this particular slide was the comparison of abilities. So abilities meaning that you're measuring their skills and competencies, and you may determine abilities through, you know, standardized testing or standardized assessment. And then you're also looking, you know, at capabilities, the potential to produce and perform, the ability to acquire skills, knowledge, or experience. So capabilities may be determined through, you know, for example, vocational testing, work evaluation, or on-the-job evaluations. So we're going to talk about some definitions pertaining to evaluation, and these are just some that we've pulled together from different program manuals, different agencies. And so when we talk about maintenance, it is necessary due to, hold on, my screen just went dead, due to participation. So if we say that an individual requires maintenance, we're talking about their participation in a particular assessment for eligibility determination. So if they have to travel, you know, for example, to participate in an assessment. Services in the IPE, we want to make sure that the assessments are included in the IPE, or if additional assessments may be needed down the road, those also need to be included in the IPE. Informed choice, we always know that consumers exercise informed choice in selection of services and service providers. And when we talk about informed choice, it's very easy to slip into language that basically says we're giving informed choice or we're allowing of informed choice, and that is not so. Informed choice is always something that the consumer has control over, and it is not up to us to either give or take or provide informed choice. This is something that is always available to the consumer, and in this particular presentation, they always have the choice of who's going to provide services to them. And then availability is something that we want to discuss, because we want to make sure that the consumer is available to complete any assessments. So we want to make sure and confirm with the consumer that yes, they are available to take any type of testing, assessments, evaluations. And then we also want to talk about self-assessment in this presentation, specifically when we talk about self-employment or career readiness, career inventories, those type things for self-employment. And there's a link here, we'll put it in the chat box also, that consumers can do self-assessments, especially in the area of self-employment. There's a wonderful website called the vrselfemployment.org site. And so this is also a resource for assessment.
Hey, Jamie, before you move on,
Paula?
I just want to
Yes, sir.
clarify something real quick, because this is something that I always get asked about, is how can we provide services prior to an IPE? And under maintenance, that's where the question comes into play. So I just want to clarify that when we're doing assessments like we're talking about today, pre-eligibility, assessment is one of the only service categories that we can provide outside of an IPE. But it has to be labeled as an assessment to determine eligibility or to determine appropriateness of services. So I just wanted to clarify that real quick. It's not every case. It's not, it's not just something that we give out. We don't give out bus passes or anything like that in eligibility status. So it's when they apply, we find out that they have a bigger need than what they're presenting with, and we need more documentation, then we provide that transportation cost to get there for the assessment. Thanks.
And
Thank you, Wayne.
Just
Yes.
want to also add, this is Paula. Much of this information is taken from section 103 of the Rehab Act. So start to get to know, where this information is coming from. So under section 103 regarding maintenance, it does indicate the exact words are maintenance for additional costs incurred while participating in an assessment for determining eligibility and vocational rehab need, or while receiving services under an IPE. So just to follow up with Wayne, those types of services in terms of assessment, paying for lodging if somebody has to go for an evaluation is a form of providing maintenance, providing meals, providing transportation costs to get to the evaluation. Those are all allowable under assessment prior to writing an IPE. So we definitely want to clarify that, and then also remind you to look at section 103 of the Rehab Act, where it entails all the voc rehab services that can be provided.
Thank you, Paula and Wayne, both for clarifying some of those points. And thank you for directing us to the Rehab Act and that section, Paula. That's good information. I know it's boring sometimes to read Fed regs, but it does give you specific definitions and information. So thank you, Paula. We're going to go on to the next slide.
I believe it was mentioned before.
Paula, you going to cover this?
Yes, I believe it was, I mentioned it before, that that we encourage programs, or we're encouraged as programs to use existing information in determining, documenting the eligibility for applicants. So most of our policies also reflect this. And so utilizing existing information, including medical records from the physician, previous psychological assessments that may be available. This could include like behavioral health records from behavioral health services, mental and psychological types of records, educational information from schools, prior employment information, if they've had prior jobs and there's information related to what types of job accommodations had been provided before, could be included in existing information. What other existing information can folks think of that they've used in the past?
This is Karen. One of the things that I've discovered about some of the existing information or medical records is when someone is released from incarceration, for instance, they may have said on their last evaluation that everything is fine. I have no mental illness. I'm not struggling with any kind of substance abuse. There is nothing wrong. And or the records can underplay the physical conditions that they may be experiencing. And so I have found that sometimes I will work with someone who does have multiple problems, but the medical record might not show it, depending upon where it's coming from and what the consumer was trying to do, leaving incarceration without any kinds of, well, then you need to go into an AODA program or you need to seek mental health. And they don't always deal with existing physical problems because they don't necessarily treat them when incarcerated. So when someone comes out, you may be left with medical records that aren't even usable. So that's one of the things that I might do an assessment for, is to find out, because everything seems fine, but it's not. And so I can't find them eligible under those records, and those might be the only ones they have going back 5 or 6 years. So that's something to keep in mind.
Thank you, Karen.
Thank you, Karen.
And
You know, one
again,
thing-
the section regarding use of existing information is contained in section 102 of the Rehab Act, eligibility and individualized plan for employment. There's a subsection within that that's highlighted use of existing information to the maximum extent appropriate and consistent with the requirements of this part. The purpose of determining the eligibility of an individual for vocational rehabilitation services and developing an IPE. The designated state unit, which is basically us, shall use information that is existing and current as of the date of the
Yes.
receipt of eligibility. So I just wanted to point out again where we're getting the use of existing information, which is under section 102.
One thing I'd like to bring up, Paul and Jamie, is something that, a lot of programs, they store their records of the previous cases, or they store incomplete applications or anything like that, where the consumer doesn't always follow through. Those are great existing information pieces that a lot of times we forget to pull. I know a lot of programs have them, but they don't go and pull the record out when the client comes back in. And I've heard a lot of times with that recidivism coming, with the consumer, they get concerned about, how do we manage this? How do we control that flow of returning clients? And that's part of it. If you have the record, the previous record, and you pull that and you use that existing information and pick up where they left off, you're going to be able to identify very specific things that have occurred previously that you can then use in your new case or in determining eligibility in the new case.
Thank you, Wayne. I'm glad you brought that up. And that's a wonderful point, that you can use existing records or previous case file information. But I'm curious if anyone has any comments on the shelf life of particular evaluations. For example, a psychological evaluation, for example. What is the shelf life for that? How long can you keep a previous evaluation and it still be applicable to this particular case? I was wondering if we could get maybe Kim or Rachel or Karen, someone.
And if you got your morning voice on,
Anyone?
you can just put it in the text or the chat box.
That's right.
I can speak for
I
Senate
know.
Nation. We tend to keep our records for 7 years. And then we will shred them according to our policies and procedures.
Thank you, Sharon. How about for the length of time you can use your psych eval? You know how long you can use a psych eval, how good it's for, how long it's good for?
Jackie, can you answer that? Jackie?
I see a comment. Roy actually commented in the chat box. He said usually 2 years. I thought I had been taught or trained 3 years, but I think it may vary, you know, depending on your program's policies.
It
We've
also
got a
varies
lot
on
of chats going on.
sorry, I started to talk over you.
Oh, that's all right. Go ahead.
It also depends on the
It's no
disability. Right?
problem.
Rachel points out here that if it's like situational depression, then we want an update. But yeah, you're right.
Mm-hmm.
For the general practice, the guidelines, it's 3 years on any psych eval or mental illness, and then you get into some of the physical or developmental stuff. If it's a more long-term, permanent, unchangeable disability, you know, there might be improvement, there might be progress, but it's never going to like change to the point of not impacting that individual's life. Then that can be a lifetime. So if you got somebody that comes in like with autism and they're diagnosed with on the autism spectrum, you don't have to get an updated report on that, other than just talking to maybe a behavioral specialist that's working with them, saying, hey, what are the new behaviors? Have there been any changes? That type of thing. But autism is never going to go away.
That's
so you
right.
don't, that diagnosis will stand on its own. It's the characteristics of the diagnosis that you need to look at. And then in a physical
right.
situation, you know, that's a 5-year window is usually what we're looking at. So if you've, let's say you've been diagnosed as a complete paraplegic, that's never going to change. It just doesn't miraculously heal, unfortunately, or I'd be in line to get that done myself. But it never changes, but the characteristics change. So every 5 years, you want to just have an update done. Like, you know, the neuropathy is still greater on the left side than the right side. It still causes this limitation or this impediment to employment. And a physical therapist or something like that can give you that information as well. So again, it goes back to that. It depends on the disability, depends on the individual with the disability, and the practice best guidelines are 3 years for mental illness or mental health diagnosis, and then a 5-year window just for updates with physical or developmental type stuff.
Thank you so much, Wayne. I'm glad you brought that up.
There's a couple comments here in the chat box I want to go over real quick. SSI or SSDI provides our guidelines as they are required to update, and they are born with a disability such as Down syndrome or a physical disability that is evidence we would contact a doctor they see or such. I think it's every 3 years for that as well. So that's Jacqueline. So in their program, they use the SSI and SSDI determination platform. And that's great too, because anytime they make a determination on a disability, it far overshoots what we require on our eligibility. So that's a great tool to use. Rachel says they also depends on if they were previously successfully closed. If there's no change in their condition and no disability, then even though their condition did not go away, they may not be considered eligible. Yes, you're absolutely right, Rachel. Thanks for bringing that up. That's the standard deal with all eligibility, right? When we talk about returning cases or that recidivism rate, anytime we look at a case for eligibility, we have to follow the eligibility criteria, and there's 6 now. And part of the returning cases, they have to have a new disability, or the disability has to have worsened and creates more impediments to employment. So it's very important that we look at that. How does the eligibility for advancement and employment impact this? Karen is trying to stump us with big questions. This is a difficult question.
Good job, Karen.
And it's kind of slippery too, right? Because it goes back to that. Is there a change? Is there no change? Is there a new disability? So for the advancement question, you always have to look at, you go back to the criteria, of course, but then in advancement, is there no other options, and is it required for VR to participate? So again, we remember when we do eligibility in our services, we level the playing field. We don't give anybody an advantage. we level it so they have the same opportunity as everybody that's not disabled to go after that position. And so sometimes maybe just providing them some information on, like with Jan, the Job Accommodation Network. Is there any accommodations out there that can help you advance in that employment? Is there any other natural supports that can help advance that employment? So that one's more of a not an assessment question, more of a following the process question. Does that make sense, Karen? And of course my answer is not helpful. I get that.
No, it is. It's something that I encountered several times with particular consumers who are in line for an advancement in their current employment, and struggling with, is there any other option? And often there's really not, depending upon what it is they want to do, or what the employer feels they need in training to be able to do this advanced position. But the employer has some dedication to the people that they have hired and that we have worked with. So they want that person in that.
Hey, Karen, we can barely hear you.
Oh,
Use your mom voice.
no. Let's see. Is that better? Is that better?
No.
No?
There you go.
Okay.
That's better.
All right. Maybe it's probably because I
And I
didn't have it
think
plugged
too,
in.
when you're talking about that, when we're talking about advancement in employment, I think automatically of consumers that come in and say, I want to go back to school, I want to advance in employment, I want to get, my degree. But what we really have to look at, is this required? And it's just like Wayne said, we're leveling the playing field, but we're not giving the consumer an advantage over anyone else. So those are areas that we really have to look at, the limitations, and is it required services?
So sorry, I didn't mean to pull you into the weeds there, Jamie. I know we're trying to do the assessment for eligibility, but
Oh, that's all right. It's great discussion. I think anytime we have discussions like this, it's helpful to everyone. So no problem. Paula, you ready to let's move forward?
Yes.
Okay, for some reason my screen's not wanting to act right. There we go.
Again, we have the eligibility criteria throughout this presentation at the beginning to again remind the key points of having a physical and mental impairment to be eligible for VR services, substantial impediment to employment, and then they require VR services to prepare for secure or regain employment. And again, assessments are necessary to determine the applicant's unique strengths, resources, priorities, concerns, abilities, as well as informed choice, including the need for supported employment if necessary. It's also important in determining factors that affect the employment and rehab needs of applicants and the barriers for preparing for obtaining and maintaining employment. Again, looking at the eligibility assessments and evaluations help us look at the applicant's abilities, capabilities, and the capacity to perform adequately in a work environment. So this is talking about eligibility, but we also need to look at it in terms of their ability to work within the work environment. Next slide, Jamie. So we look at medical and other evaluations that may be procured or after we look at existing data and evaluations that we may have, we look at other sources for how we can document the person's eligibility. So if existing documents are not available, we look at other types of areas such as is a disability not stable? We talked about some of these areas as far as earlier, some examples of information that we might need to obtain in order to determine eligibility. So again, information as well as looking at the severity of the disability as well.
And just to reiterate your notes on the slide, Paula, once an individual has completed an application for services, an assessment of eligibility and priority for services shall be conducted at that time. So to maximize the extent possible and where appropriate, the assessment should consist of a review of any existing data, be integrated or conducted in an integrated setting, and be consistent with the applicant's informed choice. Anyone have any comments? Did Joanna, I just saw your comment in the chat box. Were you trying to comment on this?
If so, Joanna can use *6 to unmute on her phone if she's able to do that. Thank you.
Okay, thanks. I'm sorry, I don't want to stop us right in the middle, but I did want to give Joanna the opportunity to address any questions. Okay, well, we'll come back to that if Joanna can talk. So let me see if I can get to the next slide. Oh, Paula, you've got all these super duper arrows pointing here. I just realized that. I'm sorry I didn't do that while you were presenting. So let's talk about types of evaluations for an eye assessment. The regulations state that you have to have a board certified doctor to complete eye assessments. Audio assessments, if you're trying to determine a hearing deficiency, psychiatric assessments, of course, if we're assessing any mental health history, also the current mental health status of the consumer, if there is a previous diagnosis, or if there's a monitoring of medications, and also if we're looking to assess any functional ability in a mental health case. Other types of evaluations are psychological assessments, so a written report with conclusions, recommendations, consumers' abilities to cope, any cognitive abilities, all of that would be included in a psychological evaluation. And we were talking in detail about traditional healing services. And a brief description is services that are reflecting the cultural background of an American Indian being served, including treatment provided by native healing practitioners within the community or recognized within the community as such by the tribal vocational rehab program, where the services are necessary to assist an individual with disabilities to achieve his or her vocational rehabilitation objective. And I know that was a mouthful, but we wanted to make sure that we described traditional healing services correctly. And I would love to hear some comments or any discussion that you would like to bring forth about traditional healing services, because I know that this sets us apart from state VR and other VR agencies specifically. And I'd like to hear any comments anyone may have on this particular service.
I'd like to comment. For the Seneca Nation, we do have some people who are looked upon as able to do some healings. And I actually had this question because with this pandemic that we've been in, I know I see a lot of, especially young mothers, who talk about their anxiety, the stress level. Uh, it's really, really hard to read because they're really suffering. And I was thinking that, are they a good candidate? They've probably never been medically diagnosed, but just looking at the conversations that go on, you can really see that some of them are really struggling. Um, I think that our traditional healers would be perfect for them, but I never really thought about them exactly being able to utilize our services through the cultural healers. So I guess I'm not sure if we would allow that.
Yeah. I'm glad you brought that up, Sharon, because I've heard comments kind of in line with what you're saying. We know this is a service that is specific to our consumers and communities and within tribal VR. But I've also heard individuals say, I'd like to use this service, but I don't know how. I don't know how to implement it in the IPE. I don't know how to find resources. I don't know how to identify a service provider. So I'm just curious if we could just discuss. I know this is in the context of an IPE, but I'd like to hear some comments from anyone that has used this.
This is Karen. I have someone that actually Berna created a list of healers through um, Northwest Indian College in terms of a list of several people for each tribe that we work with to help to develop the traditional healing services and have resources and referrals to send our consumers to. Um, in the St. Croix tribe, um, this becomes problematic because the healers were murdered, and so they very much went underground. And since I am not Native American, I usually refer someone to a lady named Auntie Hazel, and uh, let her find the person that or source that my consumer might be able to work with, or the ceremony my consumer might be able to work with. But it's not going to come to me in such a way that I would be able to use it necessarily for um, an evaluation for eligibility, because I may not have access to that information. So I also have noted that there are some concerns about confidentiality. And so in some cases, the consumer might want healing services, but they want the actual psychological assessment um, by a doctor, um, because that gives them a boundary. Um, and that seems important sometimes to them.
Thank you so much.
Jamie,
Yes, sir.
Jamie, this is Lee. Yesterday, when we were reviewing the PowerPoint, that is Jamie, Paula, and I, we had a similar but different discussion. And I'm looking at Rachel's comment about the need to consider assessment using traditional diagnosis or interpretation. And that's important. And going back to Sharon's question regarding the young women in her tribal communities who are experiencing perhaps high levels of anxiety or depression. And I believe the need for some type of counseling, or a different tribal word used for counseling needs to be identified or provided. I know on the Hopi Reservation, the behavioral health do have staff members who speak the language, or Navajo counselors who are also out there. And sometimes it's just a matter of meeting with an individual who wants to share what is troubling them, without being dismissed as being overly anxious or worried or unable to explain what's taking place. I believe those are the resources that are available, but I believe in getting specific help from traditional healers on the Hopi Reservation. We do have traditional men and women who can provide that service, also conduct a ceremony. And we all know that in the tribal communities, we don't have a specific word for disability. And sometimes this type of assessment or counseling may provide some type of a better understanding regarding the disability as interpreted from a Western point of view, but maybe interpreted from a traditional point of view that may provide a different level of understanding to the client who is seeking the help. I do know that out on Hopi, some folks, especially the elderly, don't understand the English medical terminology regarding their health issue. And when they go to a traditional healer, they will do an assessment, usually looking back at the patient's history to determine what environment he or she may have been in and whether or not the environment has an effect on their discomfort or disharmony, and also address that situation. And I believe it brings some type of closure and to be more willing to accept the Western treatment plan that may be offered in addition to taking the medication, but also recognizing that at the same time, the traditional treatment plan could just as effective. And we could get into a really long discussion on this topic because all the 86 programs are not identical. And traditional practices in some tribal communities no longer exist, or sometimes when traditional healers are absent in a tribal community, they will go to a neighboring tribe and seek help from their traditional healers.
Thank you so much, Lee. And yes, this could be just one session or one webinar on nothing but this topic. I'd like
Jamie, could I follow
to
up too?
go to the chat box.
Jamie?
Yes, please do, Kim.
I just wanted to follow up on what Karen had said, that we do have directories because we have so many tribes that we work with, but we have never seen yet anybody to use the healers for any type of assessment. They use them under the traditional Native American services, but we haven't seen anything for assessments. And I think one of the big things is when we talk to our consumers, they don't really want us to know what happens in their private sessions with traditional healers. That's their privacy. So that's why I think we don't see that when they go to, a sweat lodge or they don't really share what happens in them. So I think that's one of the big things why we don't see it.
Mm-hmm.
This
Thank you,
is
Kim.
Paula.
I appreciate that comment.
This is Paula. And
Yes,
yes,
Paula.
Kim, each community, as you point out, each community is very different. And, the seeking out traditional healing services for a diagnostic or for native healing services is a personal choice and a personal family matter. with Navajo individuals, as Lee mentioned, we do have traditional healers, men and women. Some of them are at the Indian Health Service facilities as traditional healers. So we utilize that as a comparable benefit if they go in and seek help from a native healer, medicine man, medicine woman from a Indian Health Service facility. Where I've seen it in diagnostics is again, utilize assessments to also determine the unique strengths of individuals, the concerns of individuals, their abilities, and all the great eight, basically, that we call it, for determining eligibility. We also want to look at what are some of the rehab needs and some of the barriers. So we had a consumer, for example, and I shared this with Lee and Jamie yesterday, who had an amputation, and they were set with their prosthetic, and they were in the part of eligibility. They weren't really moving forward because their prosthetic wasn't fitting accurately. They were still having several medical conditions with post-surgery. And so they went to a traditional healer for a diagnostic. And they were told, for instance, that that portion of their leg that was amputated was incinerated, was burned to dispose of it. And in our culture, we don't, incinerate body parts, and so that was a diagnostic in terms of what this person needed to do to correct that. So they went to a traditional healer to, do an offering to the fire and so on and so forth. So that's just an example, a very clear example of how traditional healing can be used within the diagnostic area. And again, that was one of our consumers that, and we have several examples, but I just wanted to point that one out. And every community is different, and we have to be respectful of each applicant's choice in seeking native healing.
That's right. Thank you so much, Paula. And I appreciate you providing that context for assessment and traditional healing. And there's a lot of chat going on. I really want to Jackie John has talked a lot about traditional healing services and how she provides that service to consumers. And she talks about, a diagnosis from a licensed practitioner, to seek sessions from a gifted indigenous healer. They're trying to see how that works and how that assessment could work differently for the consumer. And we could go on, and I just love this topic. But let's go ahead, because we want to have an activity at the end of this presentation, and it's going to take some time. So let's go ahead and move forward, talking about types of evaluations. Comprehensive evaluation, of course, is an extensive description of the consumer's assessed limitations and a variety of tests, their cognitive ability, any academic achievements, for example, their grade level completed, any physical ability, sensory ability, vocational interest, behavioral observations, and work habits. So just as it states in the title, a comprehensive evaluation includes a great deal of information. And then, hold on just a second. I don't know what in the world's wrong with my screen. Also, types of evaluations are job site assessments. For example, if assistive technology is needed, the seating or mobility or the workstation evaluation, those are different types of job site assessments. Also, home modification assessments, determining the need for any modifications, and also adaptive driving assessments. So a vehicle assessment, for example. Those are all types of evaluations. And Paula, I think you said this is a repeat. When we're talking about assessment or evaluation for eligibility determination, we're looking at these 7 functional limitations regarding employment. And Paula, I wasn't sure if you wanted to discuss this more, but I wanted to make sure that we knew that these are the seven different functional limitation areas that we're trying to determine if there is an impediment to employment based on any limitations in these seven different functional areas. Do you want to add to that, Paula?
Again, just disability affects everyone in a variety of different ways. This may look familiar to some of you because these functional areas are generally assessed when folks are in an order of selection and they put an individual in one of the three categories for order of selection. But we share this slide just to, again, remind folks that disability does affect everyone in a different way, and looking at their self-care, looking at their interpersonal skills, especially when we're talking about employment and looking at employment, self-care. She changed the slide on me, but there's 7 different areas that
I'm sorry.
that we
Let me go back up. I'm
need to
sorry,
consider.
I hit the mouse.
Again, just the different areas that we need to consider when we're looking at how disability impacts a person's life. And so we can move forward, Jamie.
So when we're identifying serious limitations, functional capacity areas, we mean that, we're looking at the individual's impairments, limitations, if there's any functioning limitations in a specific area, if that functioning ability is poor or well below what is typically expected, or if the individual requires any type of accommodations, such as special working conditions, rehabilitation technology, or substantial support or supervision, typically not made for other individuals in training or employment in the same position. So these 7 areas, these 7 functional capacity areas are mobility, communication, self-care, self-direction, interpersonal skills, work tolerance, and work skills. So within these 7 different areas of functional capacities, you're looking to identify any specific limitations or any specific impairments that cause limitations to employment. And now we're getting to the fun part. We're going to talk about outside resources for external evaluation. So if you're looking to provide evaluation services or assessment, I would like everyone to get out a sheet of paper, please. And we're going to write down a list of resources in at least 3 areas of functional capacities. So can I get everyone to take about 5 minutes and just write down a list of your resources in your area that you would go to in at least 3 areas of those functional capacities. And I'm going to put those functional capacities back up. And I'm going to do this myself.
Good morning. Can you guys hear me?
Yes. Hey, Charlene. Charlene, we're taking about 5 minutes to write down a list of resources if you were going to provide evaluation or assessment services to a consumer. And this list of resources needs to include at least 3 areas in these 7 functional capacity areas.
Jamie, will you show the slide with the list again, please?
Okay, I think we're going to go about one more minute. One more minute and we'll come back and discuss this. Okay. Is everyone completed their list? Just give me an indication on your screen. You can use the thumbs up or thumbs down or yes or no. I think I still see some folks writing. All righty. Karen, I see you're done. Hold on, my screen's not letting me see everybody. Who else has completed theirs? If I could give the thumbs up on my screen, I would. There we go. Anyone else completed? Looks like Janine's done. No one else has their video on, so I can't really tell. Tooney's done. Okay, Roy, Gina, all right. So, what everyone come up with? Do you already have a list of resources for evaluations or assessments? Who wants to go first?
This is Karen. We already have a list of resources in my area, and I think in Kim's area, and then further north into Bad River and Red Cliff, we have a particular doctor who does our neuropsych assessments, and a different doctor that also does our FCEs or our functional assessments. In both cases, we have spent time, as they are not native, doing educational components with them to help make them more aware of um, the things that they need to look for: historical trauma, intergenerational trauma, that are missing from most assessments. And I think that the thing that also you have to know is if the person if the consumer is not comfortable with the assessor, they may not be really forthcoming with information. So these are what we're looking at in the present at the time the assessment is done. So it's like a a photo or a snapshot of the person's current situation, if that makes any sense. Also, when the neural assessment can be done also as to look at personality, to look at learning disabilities, and just by observation, the neuropsych assessment, though it doesn't include necessarily functional abilities, it can be observed during the assessment that the individual is having some other physical problems. And there can also be resources made available for, well, I think this person needs to look at these other things as well. So there can be a referral on. And with the functional assessments, you're working with a medical doctor who's going to look at that person's records and then do the physical assessment to make determinations for eligibility. But it's also about what can this person do or not do. A lot of the times I'll have people who have had long-term injuries, motor vehicle accidents, head trauma, and I have no idea if they can actually work. And that hasn't been made clear by their medical records. And I also find that very helpful to find out if the person that I've started to work with can handle the job they think they can handle. Things change. I had a painter who wanted to paint, a house painter, but he couldn't do it physically anymore. And we had an assessment done to see what can he lift, what can he do. So that also allows you insight into retraining. And gives you the boundaries as well as the strengths.
Thank you so much, Karen. That is very helpful. Roy, Christy, or Gina, would any of you would like to comment on this?
Well, with Chickasaw Nation Voc Rehab, we really work with our co-op partners, with Oklahoma Department of Rehab Services, DHS for like mobility, Social Security, our own medical center, behavioral health unit. Plus we have outside contractors that we can go to for like functional. Some of you may know him, Dr. Randall Elston. He's a CBE, and he does functional evaluations. So
very
we've got
good.
a pretty good smattering of resources available to us.
That's wonderful, Roy. Gina, I'm interested in what you were saying. I like the idea that a lot of times the referring agency has already done assessments. Can you speak on that?
Once in a while, we do get people that have already done assessments. However, I did have one that had an assessment done, but she didn't want her psych eval from previous, which was kind of odd, but I understood because she had cleaned her life up a little bit, if that makes sense to you guys. So she wanted a new one. But we do work with the state like Roy was talking about. And the state is really good about keeping us in touch. They've been really good about emailing and letting us know when stuff is going on. The ones with the evals, like we do transition as well. So the IEPs that we get the evaluation on, that works. If that's a little bit, but the evaluations, it works. We did get like doctor assessments and stuff. Those work really well, especially if it's very clear as to what's going on. Medical ones are the easiest. The psych evals are a little different, but sometimes people have a lot of issues, and you've got to figure out what's going to work best for them based on that information.
Yeah, that's right. Thank you so much, Gina.
Mhm.
I'm curious if anyone could comment on, it's a lot easier when you're in an area where you have access to these resources. You have a community health provider, you have a contracted vendor. Is there anyone on today that would like to address the issues that you face when you're in a very rural area and you do not have access to very many resources? How do you provide assessments? Anyone want to comment on that?
This is Janine.
Christy. Yes.
Due to COVID, right
Yes,
now
Janine.
we're having difficulty with bringing providers into the area for assessments. I know that we have a doctor that we contract with for psych evals, but due to COVID, he was not able to travel into the area, and we were able to send a client out of the area and assist them with fuel to get there to do the assessment from another doctor that was a state recommended doctor.
Thank you, Janine. Yeah, COVID, man, that is a big problem, especially when you're bringing contracted vendors into, and you've used to have a set schedule or time frame of evaluations or assessments, and you would bring your contracted vendor in a certain time every quarter or every month, and that's caused a big problem. I'm reading what Jackie has said in the chat box. Jackie says, we have a community health provider. Oh, sorry, Jackie. We have community health providers of Seneca Nation Behavioral Health Unit for our consumers who may need assistance with mental health or substance abuse. We have a clinic on site for any mobility, functional, or other assessments for basic medical needs. We reach out to Dent Neurological for our neuropsych. We also work with state partnerships for functional testing, mobility, interpersonal skills. We do assess them while they are in the work trial, and that is within our TURC or our VR program. And it might be feasible. I'm sorry, Rachel, I was reading what you said too. It might be feasible due to COVID to explore remote or virtual assessments when they wouldn't have been considered before, or it may not be ideal, but waiting for many, many months is not ideal either. So thanks, Rachel, for that input. Anyone else would like to describe how they are addressing assessments and evaluations during the COVID pandemic? Karen also said our providers will travel to tribal community centers and tribal clinics for assessments. So it sounds like, for the most part, everyone has a pretty good resource list already established. I think if you do not, now's the time to really think about these resources, especially now that we're dealing with the COVID pandemic, and the resources that you normally would use for evaluation or assessment are not available. So now we're trying to figure out, like Rachel said, we don't have an ideal situation, but we're trying to figure out how to circumvent what's going on and how to provide these evaluations and assessments even remotely at this time. Well, we're running out of time. Let's go ahead and get back to the webinar.
While you're going back to that, I just want to read Karen's comment. Portions of the neuropsych are completed online. Then also
Yes.
Jacqueline also comments, sorry for the typos, yes, but we can do online paper pencil assessments through our labor department sites for career inventory and exploration. And I think ONET is a good example of what some programs use to provide paper and pencil. So I think it's important just to keep adding to your list. We suggest that you contact other directors or other staff who are voc rehab staff that are on this call to get ideas, because an hour and a half is definitely not enough time to really talk this topic through. So we encourage you to connect with Karen, connect with Kim and Sharon and others on this webinar to get other ideas around culturally appropriate assessments, considering those areas, considering where you get what kind of online resources you have available. So we just encourage you to do that. Go ahead, Jamie.
Thank you. Thanks, Paula. Yes. As we talk about assessment and evaluation and how to best provide that service to consumers, usually our best resources for ourselves are our peers. And as Paula suggested, you know, just reaching out to other programs or other program staff and figuring out, you know, this works in our area, but it doesn't work in that area. How do we work together to support each other and provide information to each other about these particular resources and how to provide those services to consumers? So thank you, Paula, for reiterating that. Just want to remind everyone, if you look at your screen, we have a save the date slide up here. We have a talk and circle scheduled for February the 3rd, and we're going to just talk about 2 previous webinars. Today's webinar, of course, external consumer evaluations, and we're also going to discuss the transition services for tribal youth webinar and information. So tune in with us February the 3rd for that talking circle. It'll be a great discussion and it'll give everyone the opportunity to talk about these topics. And then February the 17th, we're going to have the first of a series of webinars on mental health and tribal VR. And so the first webinar will be February the 17th, and it will be an overview of mental health and vocational rehabilitation. So we hope you tune in for that as well. Here's some AverTac business. Your feedback's very important to us, so please complete the survey for today's webinar. It helps us to better provide information to you. And if you have any suggestions or any comments, we'll be glad to have that information. So there's the link. And I think John's going to also put that link into the chat box. And we just want to thank everyone for coming today, for participating. I want to thank everyone who discussed the topics, provided information. I think the activity was a good way for us to just write down in writing, right off the top of our head, what resources we have available and how we can provide those consumer assessments or evaluations for eligibility determination. And I just want to thank Paula for being here today. I know you are busy as a program director, so I know it's difficult to set this much time aside and preparation time also for this webinar. So thank you so much, Paula, for being here with us today. And I want to thank Karen and Sharon and Jackie and Rachel, everyone that provided information and discussion for us today. I want to thank Roy, everyone that chimed in. Your contributions to this discussion just really make it so much better for everyone that participates. So thank you guys. Appreciate you so much. And also a quick reminder, I'll put my email in the chat box too. If you need CRC continuing education credits for today's webinar, please send me an email so that we can get that certificate of participation to you. And I want to thank Wayne always for being there to help with the presentation and to add to the discussion. Also, our AverTech tech support and everyone at AverTech who contributed today. Thank you so much. Appreciate you all.